What's up? And welcome to my channel. I am Tanya Octave, a licensed clinical social worker with well over 20 years of experience. And today we're diving deep into probably one of my most requested topics from various communities. I get this question constantly in my practice and even in your comments on various social platforms. Tanya, should I do breath work? Should I do meditation? What about hypnosis? Which one is actually going to work better for me if I'm struggling with anxiety or have depression or even have a little bit of trauma, maybe some historical trauma, intergenerational trauma, maybe some present trauma, the big T traumas, the little t traumas, all of that. And you know what? That is such a smart question because these three powerful modalities often get confused and they often get lumped together, but they're actually quite different in how they work and what we can accomplish together in that type of work. But today, I'm going to break down the science between all these three approaches. We're going to look at actual research, not just my opinion or some trends that might be out there, but some clinical studies that show us which techniques work best with specific mental health challenges. So whether you're dealing with anxiety that keeps you up at night or depression that can be just so overwhelming in terms of how it's experienced, or trauma that's just impacting and showing up in everyday life, by the end of this video, you'll know exactly which approach might be best fit for you for your unique needs. All right. So here's what makes this different from other, let's say, YouTube videos that you might have seen. I'm not just sharing what I've read online. I'm using these three modalities myself. And even in my clinical practice, I've seen the results firsthand from hundreds of clients. And I'm going to share with you what research, people who have studied this beyond just making things up for a good presentation, and how evidence-based practices can help make you have a better informed decision. We will also cover techniques and how it affects the brain differently, which conditions respond best to which approaches, and more importantly, how you can start using these tools safely and effectively. Plus, I'll share some surprising research findings that might kind of completely change how you think about these practices in general. So grab your favorite beverage, hopefully an organic tea or maybe some chlorophyll water, get comfortable, and let's dive into this fascinating world of mind, body, spirit healing. And don't forget to hit the like button and subscribe. It lets me know that this information is helpful. So let's start with breath work, which has absolutely exploded in popularity more recently, and for some good reason. But first, let me clarify what we're actually talking about when we say breath work, because this term kind of gets thrown around a lot with different types of explanations. So breath work refers to the intentional breathing techniques that alter your breathing patterns to influence things like your physical, your mental, your emotional state. This isn't just taking a deep breath. We're talking about specific structural breathing patterns that create measurable changes in your nervous system. What? Isn't that some great stuff? The research on breathwork is honestly very mind-blowing. A 2023 meta-analysis, which was published in Nature, that one of the most prestigious, I'll say, scientific journals in the world, analyzed multiple studies and found that breathwork interventions significantly improve things like stress and mental health outcomes. But here's what's really exciting. The effects were measurable and consistent across what? Different populations. That's beautiful. So here's how breathwork actually works in the body. And this is where it actually gets pretty even fascinating for me. When you practice specific breathing techniques like a 4-7-8 method or a cycling sigh, even a 4-4-4 method, you are directly activating your vagus nerve. This is the longest cranial nerve in your body, and it's like a super highway between your brain and your major organs. Even Stanford researchers just published a study showing that in 5 minutes of cycling sighing, that's a specific breathing pattern where you take a long inhale followed by a long exhale, can really reduce overall anxiety and improve mood more effectively than some of the other breathing techniques. Just 5 minutes. That's less than the time it takes you when you're strolling on social media. So it's like, so I know we all know how to sigh. For anxiety specifically, breathwork is incredibly effective because it directly targets the physiological symptoms. So when you're anxious, your breathing becomes more shallow and rapid, which is actually kind of maintaining this anxiety cycle. Control breathing techniques literally interrupt that cycle by activating your parasympathetic nervous system. You know, the stuff that I talk about, rest and digest. A 2024 review published in Counseling and Psychotherapy research found that breathing interventions show significant progress are significant promise for treating things like depression, major depression, or dysthymia. The research noted that breathwork can increase things like emotional resilience, enhance cognitive function, and improved overall mental well-being. What's particularly interesting is that breathwork seems to work with changing this brain chemistry, specifically increasing things like GABA, which is our brain's neural calming transmitter. Now, when it comes to trauma, breathwork requires more caution, but it can be incredibly powerful. So I do want to state that research shows that breathwork can help reduce PTSD symptoms and feelings of trauma, feelings associated with trauma. But the critical part to remember is that you need to work with a trained professional because breathing techniques can sometimes, trigger a trauma response, particularly in vulnerable populations. So be mindful of that. The beautiful thing about breath work is it is accessible. You can use it anywhere, anytime, at any moment. And particularly, it's effective for things like acute anxiety or panic attacks, or even just like our stress management. Many of my clients use breath work as their first line of intervention when they're starting to feel that anxiety rising in their body. It often prevents the need, I'll say, for even more intensive interventions. If you start to practice, your body naturally will start to do what it needs to do to heal. Breathwork tends to work best for people who like, let's say, immediate and more tangible results. So if you're someone who needs to feel like you're actively doing something to manage your mental health, breathwork could actually be a good fit for you. It's also excellent for people who struggle with traditional things like meditation because it gives your mind something more specific to focus on. Now, let's transition to meditation, which is probably the most extensive research base of all of the modalities that we're discussing today. So when I say extensive, I mean we're talking about thousands and thousands of studies spanning over decades and decades of research. So first, let's clarify what we mean by meditation, because there's many different types. Today, I'm primarily focusing on something called mindfulness meditation, which involves paying attention to the present moment without judgment. This includes practices like mindfulness-based stress reduction, loving kindness meditations, and basic awareness meditations. Harvard research, which has been studying meditation and its effect on the brain for many years, have results that are absolutely fascinating. Using functional MRI scans, they've shown that Regular meditation literally changes these brain structures, and they give you images about that. We're talking about increased brain matter in the areas of our brain that are associated with learning, memory, emotional regulation, decreased activity in the amygdala, and which is really our brain's nervous alarm system. For anxiety, the research is, I'll say, robust. A landmark study in JAMA Psychiatry found that mindfulness-based stress reduction was just as effective as an antidepressant. Ooh, some people call this Lexapro for those who are familiar with the name brand. When treating anxiety disorders, let me repeat that. Meditation was just as effective as some medications for anxiety. Like what medication? The article researched Lexapro. This is huge because it means that people can have non-pharmaceutical options that are backed by rigorous scientific research. The depression research is probably equally as impressive. Multiple studies show that mindfulness meditation can significantly reduce things associated with depression. Perhaps most importantly, reducing the risk for depression relapse, meaning depression coming back. A 2019 study in Nature found that mindfulness meditation had positive effects on depressive symptoms, particularly during stressful periods like COVID-19 or the pandemic, or there's some other names people reference it as. So when it comes to trauma, meditation shows remarkable promise, especially for PTSD. A comprehensive review published in 2024 found that all categories of meditation studied were helpful in mitigating PTSD symptoms. That means all forms of meditation that they study helped improve the decrease in PTSD symptoms. Transcendental meditation, in particular, one of my favorites, produced clinical significant reductions in PTSD studies across all areas reviewed. So let's talk a little bit about complex trauma. So for complex trauma and developmental trauma, and you can see some prior video recordings on complex trauma when I talk about trauma in a broader stance, but meditation can be incredibly healing, but it requires, let's say, a trauma-informed approach. Some people with trauma histories can find traditional modalities of meditation triggering because it involves the sitting quietly with their thoughts and their feelings. However, when practiced safely with proper guidance, meditation can help trauma survivors develop a healthier relationship with their internal experience. So whereas it might show up if you do it on your own as a trigger, that's why it's encouraged to work with a professional. This is actually something I'm very passionate about. And that's why I think I've recorded so many videos about content on trauma sensitive ways to show up, to include trauma sensitive meditation approaches that we can use and that I use in my own work. And some of those recordings, I did a season of recordings on trauma sensitive meditation. If you look at my podcast, Trauma and Social Work Podcast, this is where I share even more specific techniques. And this is really to honor survivors, their need for safety and choice in their own healing journey. So meditation is particularly, I'll say, effective for spiritual trauma because it helps people reconnect with their inner wisdom without the dogma or external authority that may have been a part of, let's say, that trauma experience in terms of their spiritual development. And then there's medical trauma, which I define really as a harmful experience between, let's say, a patient and a healthcare provider. It's not just associating things like with cancer or diagnosis of cancer, but it may be something in terms of how that relationship is being expressed and exchanged. And so when I think about medical trauma, meditation is also helpful in reducing, let's say, the hypervigilance and the anxiety that can often develop when patients feel unheard, dismissed, or even when providers don't present all options due to hospital regulations and other constraints. So what sets meditation apart is its long-term benefits, I'll say. With breath work, that might provide you more immediate relief. Meditation is to kind of help with the resilience that you build over time. Regular meditation shows increased emotional regulation, better stress management, and improved overall mental health that persists even when you're not, let's say, actively meditating. It's like healing when you're not even intentionally in the practice, once you start to develop the practice and it becomes a part of your routine. The neuroplasticity effects of meditation are remarkable as well. There are studies that show just 8 weeks of regular meditation practice can really create these measurable changes in brain structure. We're talking about increased cortical thickness in areas associated with attention and sensory processing, and decreased amygdala reactivity. Remember, that is the brain's alarm system. Meditation tends to work best for people who are really willing to commit, let's say, to a regular practice, or who are interested in more long term growth. It's particularly effective for people who want to develop a different relationship with their thoughts and emotions rather than just addressing maybe the symptom presentation. So now let's dive. Woo, I went swimming. Now let's dive into hypnosis, which is probably one of the most understood of all the three modalities that we're discussing today, I must say. As someone who uses clinical hypnosis extensively in my practice, the research on hypnosis is really just absolutely compelling. First, let's clear up what clinical hypnosis actually is, because thanks to things like stage hypnosis and shows and movies and entertainment, most people have kind of gotten hypnosis completely wrong. Clinical hypnosis is a state of focused attention and heightened suggestibility, because this allows for direct communication to your subconscious mind. You're not unconscious, you're not under anyone's control. You can't do anything that is against your will. It really is to help you achieve the goals that you want, and hypnosis is a tool. The American Psychological Association recognizes hypnosis as an evidence based treatment modality. And in 2024, a meta analysis published in Frontiers in Psychology found that hypnosis allows significant effectiveness across multiple mental and physical health conditions. Hypnosis can help the body and the mind. For anxiety, hypnosis shows remarkable effectiveness, particularly when combined with other therapeutic techniques. A systematic review found that hypnosis was more effective in reducing anxiety when used alongside other psychological treatments versus like a standalone intervention. This makes perfect sense because hypnosis enhances the effectiveness of other therapeutic techniques. So we bring hypnosis in as a tool as we're working on other stuff. It's just beautiful. Even in depression research is, you know, it's tells us some things too. So while there may be a little bit less, it's still a great body of research still, just a little bit less than anxiety. There is research in terms of longevity on the use of hypnosis for depression. And this is promising. Hypnosis appears to be particularly effective for depression when it is combined with things like cognitive behavioral treatment, psychodynamic treatment, or other evidence-based treatment. So that's why I say hypnosis works well when used in conjunction with your therapist, your licensed clinical therapist. The key to hypnosis can help people across access and really process emotions and memories that might be difficult to reach, where maybe there are some barriers or we need just an extra push in talk therapy. This is where hypnosis really shines. So in 2016, a meta-analysis found that hypnotherapy had a large, statistically significant effect on PTSDs associated across all studies reviewed. What? The overall effect size was 1.18, which in our research terms means it's a very, 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 very high positive effect. For complex trauma, hypnosis is even incredibly powerful because it allows for a gentle processing of traumatic memories without overwhelming the person's system. So their ego takes it in versus defending against it. The disassociation capacity that often develops as a survival mechanism in complex trauma can actually be accessed in hypnotic work and used therapeutically to help bring you towards a healing state. With developmental trauma, hypnosis can help people access and heal early wounds that they may not be able to access through traditional talk therapy. The ability to work with implicit memory, some somatic experiences, makes hypnosis particularly valuable for early trauma work. And spiritual work. Hypnosis can help people reconnect with their own inner wisdom and spiritual resources without the external authority or dogma that may be associated with other parts of traumatic experiences. It's a way to assess transcendental states safely and on your own terms. That's important. Medical trauma, those harmful experiences between the patient and the healthcare provider where the patient feels unheard, dismissed, and aren't fully provided all the information of all their options, responds particularly well to hypnosis. This type of trauma often involves feeling powerless in medical settings, and hypnosis can help people reclaim their sense of agency and process these difficult patient provider interactions. Many hospitals even use hypnosis as a part of their pain management and anxiety reduction protocols, which can actually help people prevent medical trauma from kind of showing up. So, what makes hypnosis unique? What makes hypnosis unique is the ability to work directly with the subconscious mind. And I felt like that alarm was a shock to your system to wake you up and really hear what I'm about to say. Because this is where many of our automatic beliefs, patterns, emotional responses, they're stored. This means hypnosis can create changes at a deeper level where techniques that work primarily with the consciousness make you feel stuck. So if you're doing work and you're feeling like you're stuck, you're not progressing, this may be the bridge that you need or the surfboard that allows you to get to the shore safely. A fascinating study really was conducted on combat veterans with PTSD are actually more hypnotically susceptible than, let's say, our general population. But this does suggest that trauma survivors may be particularly well suited to benefit hypnotic interventions, but it also suggests that you need to work with a licensed clinician in doing this type of work. Hypnosis tends to work best for people who are open to the process and who really want to work with their subconscious, I'm not subjective, but it is subjective, their subconscious patterns. It's particularly effective for people who are stuck in these repetitive thought patterns or behaviors, or even for those who want deeper levels of healing and transformation. So here's the $1,000,000 question. Which one is best for you? And here's my honest answer of 20 years of clinical practice, reviewing all types of research in various areas. It depends on you, your specific situation, and really what you're trying to achieve. If you need immediate relief from anxiety or panic, breath work is the best option. The research shows that specific breathing techniques can really reduce anxiety symptoms in minutes. It is accessible and you can do it anywhere, and it provides immediate feedback. Even Stanford researchers show that cyclical sighing breath shows measurable improvements in just 5 minutes. If you're looking for more long-term emotional resilience and overall mental health improvement, meditation might be your strongest because it is strongest in research base. The neuroplasticity effects of meditation are well documented. The long-term benefits for anxiety, depression, and overall well-being are very impressive. The fact that mindfulness-based stress reduction performed just as well as an antidepressant in clinical trials, boy, that is remarkable. If you're dealing with some trauma, particularly complex developmental trauma, even medical or spiritual trauma, if you want to work with the subconscious patterns and beliefs, the hypnosis offers that unique advantage. The research of hypnosis on PTSD shows even in large size populations, the ability to work directly with the subconscious mind makes it particularly powerful in our deep and lasting changes. But here's what I've learned in my practice. The most effective approach is really the integration. Many of my clients use breath work for immediate anxiety management, practice meditation for maybe some long-term resilience building, and use hypnosis when we're starting to do that deeper trauma work and looking at pattern changes. You know, your personality and preferences matter too. If you're someone who likes immediate, tangible results or wants to feel more actively engaged in healing, start maybe with your breath work. If you're interested in maybe spiritual growth or long-term personal development, maybe meditation might be your path. If you're curious about getting to that deeper levels of consciousness and working with the conscious, subconscious, unconscious work, then hypnosis might be perfect for you. One of the important things is to note safety. All three modalities are generally safe for most people, but if you're having a history of trauma, particularly trauma like complex developmental trauma, I strongly recommend that you work with a qualified professional, especially when starting a meditation or hypnosis practice. Breath work can also even trigger our trauma responses in some people, so start in a gentle way and listen to your body. In my Octaves method approach, I often combine the elements of all three. We may start with breath work to help regulate the nervous system, then use mindfulness techniques to develop present moment awareness, and then incorporate some hypnotic language patterns to help really facilitate that deeper change. This integrated approach really honors the fact that your healing happens on multiple levels: physical, emotional, mental, spiritual. So listen, the bottom line is this: you don't have to choose just one. You can have all three powerful tools that can really support your mental health and overall well-being in just different ways to meet your different needs. The research shows that all three modalities have significant benefits, and the best approach is obviously the one that resonates most with you and fits your lifestyle, because it's the one you're most likely to do. My recommendation is start with whatever one feels most accessible to you right now. If you're dealing with immediate anxiety, try some breathwork techniques. If you want to build long-term resilience, start with a simple meditation practice. If you're curious about deeper transformative work, explore hypnosis with a qualified professional. I'd love to hear from you in the comments section and which of these modalities are most interesting to you and things that you may want to try. Have you had experiences with any of them? Any questions that you might have? Your engagement helps me to really create content that can serve this community. And if you find this research-based comparison helpful, please give the video a thumbs up, subscribe to my channel so that I can keep producing these evidence-based mental health and wellness content. Hit the notification bell so that you will be reminded of new videos as I start to produce them. And if you're already on a personalized support and you're already kind of using any of these modalities, great. See how you can get even more into that practice. If you're curious about these modalities, I work with individuals worldwide. I am licensed psychotherapy, certified hypnotherapist, and a wellness coach. And I can really help you create and customize an approach that combines the best approaches, whether or not that's breathwork, meditation, or hypnosis for your unique needs. Remember, healing is not a destination. It's like a journey. Whether you choose breathwork, meditation, or hypnosis, or a combination of all three, you're taking powerful steps towards greater well being, resilience, inner peace, and honor. And I am honored to be a part of this journey with you. So I'll see you in my next video. Take care of yourself and remember, you have everything you need within you to heal and to thrive. Until next time, this is Tanya Octave reminding you that your mental health matters, your healing matters, and you matter.